Assalamu alaikum and hello everyone. Tetracycline is the third lecture in the series of antibacterials lectures after the antibacterials 1, the sulfonamides, and antibacterials 2, the beta-lactam antibiotics. These are the learning outcomes and I'll talk about them as we go through the presentation. Tetracyclines can be produced by biological procedure using the fermentation or by chemical transformation using the natural products. These antibiotics can be classified based on the source of the formation. Tetracycline antibiotic and some others are examples of natural source, while doxycycline, minocycline, and metacycline are examples of the semi-synthetic source. Now we'll talk about the features of these antibiotics. And tetracyclines, as you can see in this slide, consist of 4 fused cycle rings and bind to the 30S ribosome subunit to give their action and inhibit the bacterial protein synthesis. And we'll talk in details about the mechanism of action of these antibiotics later on. And also tetracyclines are active against both gram-positive and gram-negative bacteria, and the A, B, C, and D rings in the structure ahead are essential in the tetracyclines, and also the R1, R2, R3, and R4 groups in red are various in these antibiotics to give differentiality and to distinguish between these antibiotics. So continuing in the features of these antibiotics, and the 4 fused rings in the tetracycline called naphthacene. Sorry, there's a spelling mistake in the naphthacene actually, and you can correct it. And these antibiotics have different functional groups in their structure, as we will see in the structure-activity relationship slide. These antibiotics are commonly prescribed to treat acne, ophthalmic, and upper respiratory infections, and practically they have bacteriostatic properties, means inhibit and weaken the growth of bacteria. In relation to the structure of these antibiotics, tetracyclines in the list ahead are similar in their main structure, and the difference will be in the groups R1, R2, R3, and R4 surrounded by red circles, and these groups distinguish between each type of antibiotic. For example, tetracycline antibiotic has H in R1, OH in R2, CH3 in R3, and H in R4, and so on. This slide shows 2 examples of these antibiotics, tetracycline and minocycline, and you can see clearly the different groups in red between R1 to R4 in both drugs. Regarding the tetracycline stereochemistry, which is very complicated due to the large structure they have, they present many chiral centers in their structure, located in carbon atoms 4, 4A, 5, 5A, 6, and 12A, shown in the structure ahead, and all depends on the R groups attached to these carbons. You know, the chiral center means the carbon atom binds to 4 different atoms or groups surrounded. Also, in relation to the stereochemistry of tetracyclines, and comparing between oxytetracycline, doxycycline, metacycline antibiotics and other tetracyclines, these 3 antibiotics have hydroxyl group at position 5, and also they have 6 chiral centers, as you can see in their structures, while other tetracyclines have only 5 chiral centers due to the lack of chiral center at position 5. In terms of pharmacokinetics properties of tetracyclines, one of the most important features is the different intervals these antibiotics have due to the different half-lives they show. For instance, a tetracycline antibiotic is taken 4 times daily with 10 hours half-life, while both doxycycline and minocycline are taken twice daily with 15 hours and 19 hours half-lives respectively. Regarding the mechanism of action, both tetracyclines in this lecture and macrolides in the next lecture are sharing the same mechanism of action, as both inhibit the bacterial protein synthesis. However, tetracyclines inhibit 30S ribosome subunit, while macrolides, for example, erythromycin antibiotic, inhibit the 50S ribosome subunit, as we will see later. This is the mechanism of action of tetracyclines in details. Basically, tetracyclines inhibit the bacterial protein synthesis when they bind to the 30S ribosome subunit, as you can see in this diagram, and inhibit the binding of amino acyl tRNA or transfer RNA to the mRNA or messenger RNA, and stop the elongation of peptide chain and ultimately disrupt the protein synthesis. Make sure in the exam writing the full mechanism of action, and it's not enough to say only inhibit the protein synthesis. The diagram is not required in the exam, of course. One of the important properties of tetracyclines in this slide and in the next coming slides is the ability to chelate or bind with metal ions due to the presence of multiple polar or hydrophilic groups or sites which can act as Lewis base and donate their lone electron pair to the Lewis acid or to the metal ion. This action is due to the presence of beta-diketone system in rings C and B, as shown clearly in the bottom of this slide. Additional information about the chelation properties of tetracyclines. They produce insoluble salts with some metal ions, such as iron 2+, aluminum 3+, calcium 2+, and magnesium 2+. However, the chelates formed by tetracyclines with these metal ions are stable, but must be taken apart from, for example, milk, antacids, and iron salts, or avoid taking these antibiotics with milk, antacid, or iron salts to maintain the absorption of these drugs in the body. And you will see that in a graph in the next slide. This graph shows a great absorption of tetracycline drugs with high plasma concentration when it's taken on an empty stomach, while the concentration of this drug will be significantly affected when it's taken with milk or antacids. It's quite important when counseling the patient who takes tetracycline antibiotics and tell him or her that this antibiotic can cause tooth discoloration due to the chelation between the tetracycline and calcium and accumulation of tetracycline. Of course, you don't need to tell the patient about the chelation properties of tetracyclines, but you do need to tell them about the changing of the color in the tooth and staining the yellow-brown color. Also, tetracyclines can affect the child growth, so they are not recommended for children between 6 and 12 years. This is the last slide related to the chelation properties, and tetracyclines are contraindicated or prohibited in pregnant or breastfeeding women because these antibiotics can pass into the milk and also cross the placental barrier, so they must be avoided in both cases. Also, tetracyclines can affect the child's growth, so they are not recommended for children between 6 and 12 years, as I mentioned before. In addition, patients who taking anticoagulants, for example warfarin, must be counseled to monitor their INR within 72 hours of starting the antibiotic to avoid the risk of bleeding. This slide and the next two coming slides actually are very important. Tetracyclines show different isomerization in the presence of different acid strengths. The isomers produced under different acidic conditions called epitetracyclines. Two types of isomers obtained by tetracyclines in solutions. For example, at medium or intermediate pH solution, tetracyclines show C4 epimerization, and at strong acid or low pH, tetracyclines show 6,5A dehydration, as we will see in the next two coming slides. As I said, tetracyclines give 4-epitetracycline or show C4 epimerization at intermediate pH. Usually, the resulted isomer is inactive. As you can see, the difference between the natural or active form of tetracycline on the left-hand side with dimethyl group at position 4 with dotted line surrounded by a red circle pointing away from the reader or away from the viewer, while this group is orienting or pointing towards the viewer with solid line and make it inactive form of tetracycline isomer as shown on the right hand side in this slide. However, at low pH and in strong acidic solution, tetracyclines show 6,5A dehydration, means losing hydrogen and hydroxyl groups from positions 5A and 6 of the active form on the left hand side to produce the inactive form of tetracycline on the right hand side, presented with double bond between the carbons 5A and 6. Now we'll talk about the structure activity relationships of tetracyclines in the last 3 slides of this lecture. First of all, tetracyclines must have 4 rings to show activity, and anything less than 4 rings will make it inactive. Also, removal of hydroxyl and methyl groups in position 6 of tetracycline structure on the left can give 6-dimethyl 6-deoxy tetracycline on the right, which is the simplest form of tetracycline antibiotic can show activity. 2 important points in this slide. First, the enol structure, which is alkene connected to hydroxyl group with one end. The enol structure must be intact and perfect in order to tetracycline to show activity. Also, the second point, the amide group at carbon 2 must be there for activity, and replacing this group with other group like aldehyde or nitrile will reduce or lose activity. Finally, and also in relation to the amide group of the tetracycline structure, I can simply conclude this slide for you. First of all, the activity can be either reduced or maintained by any change in the amide and 4-dimethyl amino groups, both connected to ring 8, which is the first ring of the tetracycline structure on the right, connected to ketone group. So the activity can be reduced in 2 cases. First, if the hydrogen of the NH2 in the amide group was substituted by large amino alkyl, and second, if the 4-dimethyl amino group was removed. However, the activity can be retained and maintained if only small amino alkyl group was replaced the hydrogen in the amide group, as shown in the Rolly tetracycline antibiotic resulted, which is more water soluble than tetracycline. And here are the outcomes of the lecture, and you should be familiar with them at the end of this lecture. And again, this is the reference book, and many thanks for your listening.